Question number 1. A 28-year-old male is brought to the casualty with a 2-day history of high-grade fever, severe muscle rigidity, and altered sensorium. He was started on haloperidol. Remember haloperidol. For acute psychosis 5 days ago. On examination, his temperature is 104 degree Fahrenheit, heart rate is 120 beats per minute, and there is lead pipe rigidity on all the limbs. Lab investigations show a significant elevation of serum creatinine phosphokinase. CPK levels have been increased. Please remember that means there is some muscle injury. What is the most appropriate immediate step in the management? The options are: option A, administration of IV benzotropine. Option B, start IV dantrolene and stop haloperidol. Option C, perform an urgent lumbar puncture to rule out meningitis. Option D, increase the dose of haloperidol to control the agitation. Please write your answer in the comment box. The correct answer is start IV dantrolene and stop haloperidol. This answer is correct because the clinical picture of fever, lead pipe rigidity, and high CPK after starting an antipsychotic points to NMS. The treatment involves stopping the offending agent and using dopamine agonists or muscle relaxants like dantrolene. Next question. Question number 2. A 35-year-old woman with a known history of bipolar disorder presents with complaints of polyuria and polydipsia. So she has bipolar disorder. She has been on lithium therapy for the past 3 years with good control of her mood symptoms. Her serum lithium level is 0.9 milliequivalent per liter. Which of the following is the most likely cause of her current symptoms? Options are: option A, psychogenic polydipsia due to manic relapse. Option B, lithium-induced nephrogenic diabetes insipidus. Option C, lithium toxicity, that is serum levels are more than 1.5 milliequivalent per liter. Option D, development of type 1 diabetes mellitus. So this is a case where there is no indication of type 1 diabetes mellitus. So option D is ruled out. So the lithium levels are normal. So lithium toxicity, that is ruled out. The answer is between A and B. The lithium induced nephrogenic diabetes insipidus. This is the answer because lithium can cause the kidneys to become resistant to ADH, that is antidiuretic hormone, by interfering with the intracellular signaling in the collecting ducts. Next question, question number 3. A 24-year-old medical student feels extremely angry at her professor for giving her a low grade. However, during their next meeting, she behaves in an excessively polite, helpful, and overly respectful manner towards him. Which defense mechanism is she demonstrating? The options are: option A, reaction formation. Option B, displacement. Option C, sublimation. Option D, projection. So please write your answer in the comment box. The hint here is the individual is expressing the polar opposite of her true unacceptable feeling. The correct answer is option A, reaction formation. The reaction formation is the conversion of an unwanted or dangerous impulse into its opposite to reduce the anxiety. Next question. Question number 4. A 45-year-old chronic alcoholic is brought to the emergency department 48 hours after his last drink. He is agitated, tremulous, and reports seeing insects crawling on the walls. On examination, he is disoriented to time and place. His heart rate is 130 beats per minute and he is sweating profusely. What is the diagnosis? Options are: option A, Wernicke's encephalopathy. Option B, Korsakoff's psychosis. Option C, delirium tremens. Option D, alcoholic hallucinosis. Please write your answer in the comment box. The hint is: look for the combination of clouding of consciousness and autonomic hyperactivity in the context of alcohol withdrawal. The answer is delirium tremens. Delirium tremens is characterized by altered consciousness, that is disorientation, vivid hallucinations, and severe autonomic instability like tachycardia, diaphoresis, usually 48 to 96 hours after the withdrawal. So next question, question number 5. A 30-year-old woman complains that for the past 7 months, she has been hearing voices of 2 men talking about her in the third person. commenting on her daily activities. She also believes that the local news anchor is sending her coded messages through the television. She has no significant mood symptoms. What is the most likely diagnosis? A beautiful mind. The options are option A, schizoaffective disorder, option B, schizophrenia, option C, delusional disorder, option D, schizotypal personality disorder. So please write your answer in the comment box. The hint is third person auditory hallucinations are a classic of first rank symptom of this condition. What is this condition? The answer is schizophrenia B. That's the correct answer. The presence of third person auditory hallucinations and delusions of reference for more than 6 months meets the DSM 5 criteria for schizophrenia. Next question, question number 6. Which of the following antidepressants is preferred in a patient who is concerned about weight gain and sexual dysfunction but has a history of seizure disorder? Options are option A, fluoxetine, option B, mirtazapine, option C, voltioxetine, option D, bupropion. So please write your answer in the comment box. Hint is you need an agent that is weight neutral and sexual function sparing, but you must avoid the one that lowers the seizure threshold. The correct answer is option C, voltioxetine. Voltioxetine is generally weight neutral and has a lower incidence of sexual dysfunction compared to SSRIs without the seizure risk of bupropion. Next question. Question number 7. A 19-year-old girl is brought by her parents with a BMI of 14.5 kg per meter square. She insists she is fat and she refuses to eat, often exercising for 4 hours a day. Examination reveals fine downy hair on her back and bradycardia. What is the most common cause of death in patients with such conditions? Options are option A, cardiac arrhythmia, option B, gastric rupture, option C, suicide, option D, renal failure. So please write your answer in the comment box. The hint is consider the physiological effects of starvation and electrolyte depletion on the heart. The correct answer is cardiac arrhythmia. Electrolyte imbalances like hypokalemia and structural changes in the heart in anorexia nervosa, it leads to fatal arrhythmias. That is the leading cause of death in such cases. Next question, question number 8. A 7-year-old boy is brought for the evaluation due to poor academic performance. His teacher reports that he cannot sit still, frequently interrupts others, and he often loses his school supplies. These behavior are present at home as well. What is the first line pharmacological treatment for this condition? Options are option A, atomoxetine, option B, risperidone, option C, clonidine, option D, methylphenidate. So please write your answer in the comment box. The hint is the condition is called ADHD, attention deficit hyperactive disorder. Think of the class of drugs that increases the dopamine and norepinephrine in the prefrontal cortex. The correct answer is D, methylphenidate. It stimulates the first line pharmacological choice. Methylphenidate, the stimulants like methylphenidates are the first line pharmacological choice for ADHD due to their high efficacy in improving focus and reducing the hyperactivity. Next question, question number 9. A 40-year-old man believes that his wife has been replaced by an identical looking imposter who is trying to harm him. He recognizes that the woman looks exactly like his wife, but he is convinced she is not the same person. This is known as, options are option A, D, Clarambold syndrome, option B, Cotard syndrome, option C, Fragoli syndrome, option D, Capgras syndrome. Please write your answer in the comment box. The hint is this is a delusion of doubles. It involves a familiar person being an imposter. The correct answer is Capgras syndrome. Capgras syndrome. It is a delusional misidentification where a patient believes a familiar person has been replaced by an identical double or imposter. This is Capgras syndrome. Next question, question number 10. A patient with refractory schizophrenia has failed trials of risperidone and olanzapine. The psychiatrist decides to start clozapine. Which of the following monitoring protocols is mandatory due to the risk of agranulocytosis? Options are option A, weekly serum creatinine for first 6 months, option B, biannual EEG electroencephalogram, option C, monthly liver function tests LFT, D, weekly WBC count and absolute neutrophil count. So please write your answer in the comment box. The clozapine, it's the most dangerous side effect of clozapine. It involves the depletion of a specific type of immune cell. We have to look at option D, that is the correct answer, weekly WBC count and absolute neutrophil count. The clozapine, it carries 1% risk of life-threatening agranulocytosis, necessitating strict hematological monitoring, that is weekly in the initial stages. So these are the 10 questions of psychiatry. Let us meet in the next video. Thank you.